My name is Douglas White. I'm a physical therapist practicing in Hawaii, and I'm a member of the American Academy of Orthopedic Physical Therapy Scope of Practice Task Force. And we are doing a series of interviews of physical therapists in rural health settings and getting their perspective on what it's like to practice in rural health and what opportunities they may be. And joining me today, I have Rachel Jermann, who is practicing in Alaska. And I'll just ask Rachel to introduce herself, and we'll talk about rural health for a few minutes.
So my name is Rachel Jermann, as you already mentioned. I am a physical therapist in Kodiak, Alaska, which is an island about 300 miles south of Anchorage. So it's either about a 45-minute plane ride or a 12-hour ferry ride. I work for a tribal health organization here in Kodiak. So we serve not only Kodiak, the town city, but we serve our outlying villages that are only accessible by boat or plane. I've been working in tribal health for almost 3 years now. Prior to that, I worked at the Critical Access Hospital here in Alaska. I graduated in 2017 from the University of Wisconsin-Milwaukee with my DPT, and then I completed my orthopedic residency at Kaiser in Oakland, California.
Great. Could you kind of describe your health setting where you practice in now?
Yeah, so I practice in primarily outpatient. We see everything across the spectrum, but it's primarily outpatient orthopedics. But we pick up everything from dizziness, any neurologic caseload that we need to. When we travel to the villages, we are really like kind of seeing whatever comes in the door. I currently have a staff of 4 other physical therapists, and we're always looking to expand. So we're pretty well staffed at this point, surprisingly.
Great. So kind of a lot of primary care PT too.
Mm-hmm.
Sounds like it's great. So what do you find rewarding about practicing in a rural community?
Well, where I work now in tribal health, we're actually we're a primary care organization, patient-centered medical home. So I work really closely with our primary care physicians, so I can instant message them, I can call them at pretty much any point in time, which is really nice about where I work now. When I worked at the Critical Access Hospital, I wouldn't say that was the same, but I enjoy where I work now because we work really tightly with our case management teams, with primary care, and I can even instant message surgeons as well, which is really nice. As far as being in a rural community, I do really like how close-knit everything is. I enjoy that my patients want me to see their family members. I enjoy that we have a lot to do outside, but we do have a lot of limitations as far as how patients access exercise and those kinds of things because we're remote, really. Yeah, and then when we talk about specifically in the villages, there are a lot more challenges, but I really enjoy going to the villages and learning more about how everybody lives, what their needs are, and it's very different from what you would see in a clinic in the city.
Save the date for the 2024 AOMPT Conference, October 23rd to the 27th in Orlando, Florida. Join OMPT professionals for 5 days of continuing education focused on OMPT, hands-on learning, research, networking, and more. Visit aaompt.org for more information.
Great, thank you. So what could you say to your colleagues to encourage them to consider practicing in a rural community?
It kind of depends on what people want. I've worked with some researchers, and one of the big questions that I have is, we have a lot of people who are open to traveling to rural areas, but where the rubber meets the road is really retention. So the question isn't like, what does it take to get you to go to a rural area? It's really what would make you stay? And that's a much harder question to answer because I get a lot of people who want to travel to Alaska and they want to come for 3 months, but unfortunately, like that doesn't really work for our patient population. So we prefer to hire permanent versus travelers, as I'm sure you probably feel the same way. Travelers are also expensive. So the real question is like, what gets people to stay? And usually it's the community. Like When I talk to people who they want to live in a close-knit community, they like being close to the outdoors, maybe they like hunting or fishing or those kinds of things. Like I live in a world-class location for fishing in particular. So those are the kinds of things that I usually talk up to people. Some people will just not thrive in a rural environment. They want to be close to a city. They want to be able to drive within an hour to an airport and be able to fly to a major city. We don't really have that. But if you enjoy being in the outdoors, if you enjoy a diverse and like caseload as far as what you're treating, if you enjoy having to be on your toes and constantly learn new things so that you can adapt to your patient population, that's a really good fit for you.
Great, great. I think you touched on this a little bit, but what's some of the local and systemic challenges to practicing in a rural environment?
So for us, I would say one of our biggest challenges is that we we don't have an orthopedic surgeon on our island. So if you're treating someone if someone gets a total knee, what they're doing is they're flying to Anchorage, they're getting their total knee, and they're getting on a plane and they're flying back. So for post-surgical patients, it is a major challenge, one of our biggest, and that's not everybody we treat, but it is the one that makes me want to beat my head against the wall the most. Trying to establish care coordination across that distance. We often have patients who just never make their follow-ups because they get weathered out. So you are constantly trying to establish a plan of care, work with the surgeons, those kinds of things, so that your patient has the best experience possible. We also, specifically here in Kodiak, we have a weather issue. So for our patients in the villages, for example, last year in the month of June, I was supposed to go to 3 different villages and I made it to none of them because we had fog for practically all of June and we couldn't fly. Our pilots do fly. We fly in the little, often in the little 5-seater Cherokee planes. Pilots fly line of sight here. So getting to and from our villages can be very challenging when we get bad runs of weather. And then just being on an island and being remote, you just have to MacGyver things sometimes. Like you have to be willing to experiment. You also have to be really willing to meet your patients where they are. I know sometimes in PT, we give walking boots a bad name, but I have some patients who are like, I'm going to go to work no matter what. And I'm like, all right, well then you can't really walk on your ankle, but you're going to do it anyway. So I might as well put you in a walking boot for a few days, so at least you can offload a little bit. So there is more of an expectation that you're going to meet the patient where they're at, because often they have to subsistence fish, or they do have to go to work, and you don't really have any other options, and they're going to do it anyway. So might as well just be along for the ride.
Yeah, I can understand that. And this segues nicely into the next, our last question here about how is patient management different in a rural environment?
So like I talked about earlier, it kind of depends on where you work. In Alaska, we have a lot of tribal health and tribal health organizations. And when we talk about tribal health, it's very different because it's not necessarily a closed system, but all your patients are generally being seen by your primaries and by you. So you can develop really close relationships. I know, I can call all of our case managers. We can set up travel for our patients. Our organization works as a whole to do that. When I worked in the critical access hospital, I didn't necessarily have access to those things. So that was a lot different. That was a lot more on the patient. So I would say that perhaps it doesn't matter as much rural versus remote as the organization that you work for. So tribal health is vastly different from regular commercial payer services. And so I'm very lucky. I can do all these things. I can coordinate fairly easily. We really work as a team to get the patient what they need. But if I was working in private practice or at a hospital, it would be mostly significantly on the patient to do the bulk of the work.
As a dedicated orthopedic physical therapist, you understand the importance of staying current with the latest techniques to better serve your patients. With gait analysis, continuing education, and technology, Run DNA is committed to accelerating your expertise so you can help runners achieve their best. Visit rundna.com/AOPT to learn more and get your free ebook, Top 5 Things Running Professionals Need to Know.
Great. Any last thoughts that you'd like to share?
I mean, I think that what I tell like students when I talk to them is every rural area is different. So some people think like, oh, well, people don't have internet. Well, here we got access to Starlink like months ago. So that's not as much big of an issue anymore. Like my brother-in-law or whatever can stream Netflix in the middle of the Bering Sea. Like we have internet, but other people in, say, West Virginia may not even have fiber optics yet. So it's really important when we think of rural areas that we understand like what exactly makes up that rural area, because they don't all look different. Some have better resources than others. And when we start to pigeonhole everybody into the same definition of rural, I think we get ourselves into trouble.
Well, that's great. That's been very helpful. It's been a pleasure to talk to you, and I hope you can have continued success.
Cool. Thank you so much. I appreciate the chance to speak with you.